Welcome to our third and last video on movement disorders. Let's begin. In this lecture, we'll cover restless leg syndrome and Tourette syndrome. We'll discuss definition, risk factors, clinical features, diagnosis, and management. Restless leg syndrome is a sleep-related movement disorder. It may be primary, in other words, idiopathic, or secondary, associated with comorbid conditions. Let's review the risk factors for this syndrome. They include family history, iron deficiency anemia, uremia, and pregnancy. Multiple sclerosis, Parkinson's disease, neuropathy, as well as medications such as metoclopramide are also involved. The patient with restless leg syndrome presents with unpleasant urge to move the legs. The feeling may be described as crawling, tension, electric, creeping, or itching. The symptoms are often commonly in the evening and at rest. They typically improve by movement. For example, the patient may state that the symptoms are usually relieved by walking or stretching the legs. Let's move on to the diagnosis by discussing the diagnostic criteria of restless leg syndrome. They include an urge to move the legs, usually with uncomfortable or unpleasant sensation. The symptoms start or get worse during rest or times of inactivity. Also, they get worse in the evening or at night. Symptoms are partially or completely relieved by movement. And finally, the symptoms cannot be explained by another condition. A 60-year-old man comes to the office reporting a crawling sensation over his legs when he lies down in bed at night. Crawling sensation improves when he massages his legs or walks around the bed. His wife has recently complained of him kicking his legs in his sleep. Colonoscopy 10 years ago revealed several hyperplastic polyps in his sigmoid colon. Serum creatinine and BUN are normal. Which laboratory tests should be ordered to check for the underlying cause of this patient's condition? This patient has a crawling sensation over his legs when he lies down in bed at night. This sensation improves when he massages his legs or walks around the bed. He also has involuntary leg movements at night. All these findings point toward the diagnosis of restless leg syndrome. Restless leg syndrome is commonly associated with chronic kidney disease and iron deficiency anemia. His serum creatinine and BUN are normal, making chronic kidney disease unlikely. Considering that he has hyperplastic polyps in the sigmoid colon, he may have occult gastrointestinal bleeding and resultant iron deficiency anemia, triggering the restless leg syndrome. Therefore, iron panel with serum ferritin, serum iron, total iron binding capacity, and transferrin saturation should be ordered in this patient. Let's discuss management. First of all, oral iron therapy should be administered to patients with restless leg syndrome if the serum ferritin is less than 75. If the patient complains only of mild symptoms, then the mainstay of management involves avoiding the aggravating factors, doing exercises, as well as leg massaging. However, if the patient has moderate or severe symptoms, medical therapy is indicated. We typically use dopamine agonists such as pramipexole or alpha-2 delta calcium channel ligand such as gabapentin. Let's move to our last topic, Tourette syndrome. We will discuss definition, clinical features, diagnosis, and management. Tourette syndrome is a chronic neurologic disorder. The hallmark of this disorder is motor and phonic tics. It's associated with genetic predisposition. Let's discuss clinical features. As we mentioned, tics are the main feature of Tourette syndrome. These are sudden, brief, intermittent movements or sounds. Onset of symptoms is between 2 and 15 years of age. Some common examples of motor tics include blinking, facial grimace, shoulder shrugging, copropraxia, and echopraxia. Copropraxia is the involuntary or uncontrollable expression of obscene gestures, and echopraxia is the involuntary repetition of others' actions or movements. Common phonic tics in Tourette syndrome include moaning, sniffing, grunting, coprolalia, and echolalia. Coprolalia is the involuntary expression of obscene words, and echolalia is the involuntary imitation of other sounds or words. It's important to note that symptoms of Tourette syndrome usually improve during adolescence or childhood. Tourette syndrome may be associated with comorbidities. Most commonly, they include attention deficit hyperactivity disorder or obsessive compulsive disorder. To make a diagnosis of Tourette syndrome, we should rely on the diagnostic criteria. So let's learn them. The diagnostic criteria include presence of multiple motor tics and one or more of phonic tics. The tics should be recurrent, occurring multiple times a day and nearly every day. The presence of tics lasts more than 1 year, and onset is before 18 years of age. Finally, the tics cannot be explained by other conditions. For the management of Tourette syndrome, comprehensive behavioral intervention for tics is used. This is a type of non-pharmacological therapy that helps patients change their behaviors in order to manage and reduce tics. Medications can also be used, such as tetrabenazine. Also, when the patient has focal motor or phonic tics, botulinum toxin injections into the involved muscle can be considered. A 9-year-old boy is brought to the physician by his parents due to difficulties at school for the past year. His classmates make fun of him because he makes grunting and barking sounds during every lesson. The parents have also noticed occasional head thrusts, eye blinks, and facial grimacing at home. His vital signs are unremarkable. Physical exam reveals a boy with intermittent eye blinks and barking sound. Parents ask about the prognosis of their son's condition. Which of the following conditions is this patient at risk to develop? A. Oppositional defiant disorder. B. Attention deficit hyperactivity disorder. C. Disruptive mood dysregulation disorder. D. Autism spectrum disorder. This 9-year-old boy has been making grunting and barking sounds for the last year. They are considered to be vocal tics. The parents have also noticed occasional head thrusts, eye blinks, and facial grimacing at home. Therefore, the patient also has multiple motor tics. Multiple vocal and motor tics lasting at least a year in a person less than 18 years of age is consistent with the diagnosis of Tourette syndrome. Tourette syndrome is associated with two comorbidities: obsessive compulsive disorder and attention deficit hyperactivity disorder. Therefore, this patient is at risk for developing attention deficit hyperactivity disorder. The correct answer is option B. Here's a slide reminding us of the comorbidities of Tourette syndrome. Let's discuss why the other options are incorrect. Option A, oppositional defiant disorder. Option C, disruptive mood regulation disorder. And option D, autism spectrum disorder are not associated with Tourette syndrome. And that concludes our lecture on restless leg syndrome and Tourette syndrome.